Lung cancer is one of the most common and deadly forms of cancer worldwide. It occurs when abnormal cells in the lungs grow uncontrollably, forming a tumor that can interfere with the lung's primary function supplying oxygen to the body through breathing. Over time, these cancerous cells can invade nearby tissues or spread to other parts of the body, metastasis, making the disease difficult to treat if not detected early. Overview and types of lung cancer. Lung cancer is broadly categorized into two main types, each with different biological behaviors and treatment options. Non-small cell lung cancer, NSCLC. This is the most common type, accounting for about 80 to 85% of all cases. It grows and spreads more slowly compared to other forms. NSCLC includes subtypes such as adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. Adenocarcinoma often develops in the outer parts of the lungs and is commonly seen in both smokers and non-smokers. Squamous cell carcinoma usually forms in the central part of the lungs, near the bronchi. Large cell carcinoma can appear in any part of the lung and tends to grow quickly. Small cell lung cancer, SCLC. Representing around 10 to 15% of cases, SCLC is strongly associated with smoking and is known for its rapid growth and tendency to spread early. Though it often responds initially to chemotherapy and radiation, it has a high chance of returning after treatment. Causes and risk factors. The main cause of lung cancer is tobacco smoking, responsible for more than 85% of all cases. Cigarette smoke contains thousands of chemicals, many of which are carcinogenic, cancer-causing. However, lung cancer can also occur in non-smokers due to other risk factors, including second-hand smoke. Regular exposure to smoke from others increases risk. Air pollution. Long-term exposure to polluted air, especially fine particulate matter, can damage lung cells. Radon gas, a naturally occurring radioactive gas that can accumulate indoors, particularly in poorly ventilated areas. Asbestos exposure, common in certain occupations such as construction, shipbuilding, and insulation work. Family history and genetics. Having a close relative with lung cancer may slightly raise the risk. Previous lung diseases, conditions like chronic obstructive pulmonary disease, COPD, or tuberculosis can contribute to risk. Symptoms of lung cancer. In the early stages, lung cancer often shows no symptoms, which is why many cases are diagnosed late. As the disease progresses, symptoms become more noticeable and may include persistent cough that does not go away, coughing up blood or rust-colored sputum, chest pain that worsens with deep breathing or coughing, shortness of breath and wheezing, unexplained weight loss and fatigue, hoarseness or voice changes, frequent chest infections such as bronchitis or pneumonia. If the cancer spreads to other parts of the body, it can cause additional symptoms like bone pain, headaches, or neurological issues. Diagnosis. Early detection is critical for improving survival rates. Doctors use several methods to diagnose lung cancer, including imaging tests, chest X-rays, CT, computed tomography, scans, and PET scans help locate suspicious areas. Sputum cytology, examining mucus under a microscope to detect cancer cells. Biopsy, removing a small tissue sample from the lung or lymph nodes for laboratory analysis. Bronchoscopy, using a thin tube to view the airways and collect samples. Once diagnosed, additional tests determine the stage of cancer, indicating how far it has spread and guiding treatment decisions. Treatment options. Treatment depends on the type, stage, and overall health of the patient. Common approaches include surgery, used mainly for early-stage NSCLC to remove the tumor and part of the surrounding tissue. Radiation therapy, high-energy rays target and kill cancer cells. It is often combined with other treatments. Chemotherapy, drugs administered orally or through injection to destroy rapidly growing cells throughout the body. Targeted therapy, medicines designed to attack specific genetic mutations or proteins that promote cancer growth. Immunotherapy boosts the body's immune system to recognize and destroy cancer cells. For advanced stages, treatment focuses on prolonging life and improving quality of living rather than complete cure. Prevention and lifestyle changes. The best way to prevent lung cancer is avoiding tobacco smoke. Quitting smoking at any age significantly reduces risk. Other preventive measures include testing homes for radon gas and fixing leaks, wearing protective masks in hazardous work environments, maintaining a healthy diet rich in fruits and vegetables, exercising regularly to strengthen lung function, reducing exposure to air pollution when possible. Prognosis and outlook. The prognosis for lung cancer depends largely on its stage at diagnosis. When detected early, stage I or II, survival rates are significantly higher. However, because many cases are discovered late, lung cancer remains one of the leading causes of cancer-related deaths globally. Advances in precision medicine and immunotherapy are gradually improving outcomes and offering new hope to patients.